This is week 11, part 3, and again, we're just following the ARRT content specifications. We just finished up with medications, and now we're into infection control and prevention, disinfection. So a disinfectant cleans a surface, whereas an antiseptic cleans the skin. Medical asepsis, those are procedures that reduce the number of microorganisms. So that's just your overall cleanliness, cleaning the x-ray table, hand washing, just overall making sure things are clean, versus surgical asepsis or surgical asepsis encompasses sterile technique. So those are procedures that remove all microorganisms, sterilization of instruments, creating a sterile field. So that's the difference between medical asepsis and surgical asepsis or sterile technique. How a disease is transmitted from one person to another. So you've got three routes. There's direct, airborne, and droplet. So direct is one person directly has contact with another, so handshaking, kissing, and sexually transmitted diseases, direct contact. There's airborne. Someone coughs, causing the microorganism to float around in the air, and then someone else inhales it. And then there's droplet. Someone coughs, and an actual droplet of sputum or saliva lands on another person. Types of precautions. There are standard precautions and transmission-based precautions. So again, standard precautions, again, that's how we treat all patients. That is, again, just your overall cleanliness, how we treat all patients. Whereas transmission-based precautions, that's how we treat patients if they are known to have a disease that is spread by one of those routes, direct, airborne, or droplet. For example, they may require a private room, we may have to wear a mask, or they may have to wear a mask, things like that. So that's the difference between standard precautions, that's how we treat all patients, and transmission-based precautions. That's how we treat patients with a known disease, such as TB, tuberculosis, influenza, MRSA, VRE, things like that. Now, I do need to point out also that under standard precautions, we assume that all fluids are contaminated. We assume all fluids are contaminated, including bloodborne pathogens. So bloodborne pathogens are based under standard precautions because blood is a fluid, and we assume all fluids are contaminated. Okay, handling and disposal of biohazardous material. Again, when cleaning equipment, you use a disinfectant. When cleaning the table, start with the least soiled area and progress to the most soiled area. Floors are always considered contaminated. Place dampened or wet items in waterproof bags. When sending items to be re-sterilized, place into waterproof bag labeled biohazard. If the outside of the bag becomes contaminated, place a second bag over it. And do not recap needles, place in puncture-proof containers. Okay, moving on to reactions. So allergic type reactions are categorized into minor, intermediate, and severe. So your minor contrast reactions are going to be hives. The medical term for hives is urticaria. Another minor would be itching, and some more minor allergic type reaction would be nausea, vomiting. Intermediate type reaction would be mild laryngeal edema, so meaning mild throat swelling. And then a severe allergic type reaction would be a severe laryngeal edema. Allergic type reactions are treated with Benadryl, epinephrine, and steroids. The rest of these are adverse reactions, but they are not considered allergic type. Okay, allergic type are the ones that cause hives, itching, nausea, vomiting, laryngeal edema, things like that. But there are other adverse reactions, but they're just not considered allergic type. First is the hemodynamic response. And again, because contrast is, quote, heavier or hyperosmolar, or meaning it contains more particles, contrast contains more particles than blood, it's heavier, it can cause major movement of water from inside the blood vessel to outside the blood vessel, and vice versa. This can lead to episodes of both hypotension and hypertension, and it just continues back and forth, and that movement of the water causes hemodynamic responses because the contrast is heavier. Contrast can cause nephrotoxicity. Remember, contrast can cause a patient that's in mild renal failure to develop severe renal failure. So again, that's why it's so important to check those lab values. Remember, renal failure is the failure of the kidneys to filter waste, including contrast, out of the blood. And you need to know those normal values, the BUN and creatinine. It varies from place to place, but the BUN is usually about 8 to 24 is normal, and the creatinine is about 0.5 to 1.5 is normal. CNS reactions, central nervous system reactions. When the vagus nerve is stimulated, it causes bradycardia, a slowing of the heart, which then leads to hypotension, low blood pressure. Causes of the vagus nerve being stimulated are anxiety, pain, the needle puncture, and injection of the contrast. These are called vasovagal reactions, and vasovagal reactions are treated with atropine. So again, that bradycardia and hypotension is treated with atropine. A feeling of warmth and a metallic taste in the mouth are considered expected side effects and not reactions.